it is a great privilege and honor to be here with you. And my presence as the chair of the Association of People of the Greek Patient Association reflects the fact that WHO makes true the motto that we want a patient-centered healthcare, and having us today here in front of you demonstrates how we wish to work together. The Greek Patient Association is also a member of the European Patients Forum, which also extends their thanks to you. And we also have, of course, a colleague of ours, Dimitris Athanasiou, who is a board member of the European Patients Forum, and will moderate a session called Patients' Perspectives on Quality and Patient Safety. And on that, I would like to say that from my point of view, when we call for quality in care, the way that patients translate this is quality of life and well-being. This is what I think we want to achieve once we have quality in healthcare. And within the context of the universal health coverage, what patients, of course, and citizens, what we want is equity and quality. And what we wish, of course, is an increased investment in this domain. I have been a part of an initiative from my disease area where I come from. I'm from the HIV sector. I'm the chair of the Association of People Living with HIV in Greece. And with colleagues of ours, we recognized what we saw as the most important challenge that we are facing. And that had to do with aging and comorbidities, and how, on one hand, and on the other side, of course, the other side of the spectrum, on pediatrics and rare diseases. And we wish to focus on that, and we, following on the debate on health outcomes, we started an initiative called HIV Outcomes, in which we wanted to advocate for people living with HIV to enjoy the highest possible health-related quality of life. Actually, in this initiative, we had as co-president former regional director Marc Danjon, who has helped us and guided us in that process. So one of the biggest findings in what we in our work was the huge problem we were facing on mental health. So once again, this priority is, of course, central to the European program work. I'm not sure. I forget the order. So for us, this is going to be a great opportunity to engage in this. We also believe we need countries to be more receptive on and recognize the importance of the WHO Center of Excellence for caring for quality in care, and I would urge to increase its resources in order to be able to perform their work. Yesterday, the day before, on the 30th of November, was the first day on my position as chair of the association, and I had the honor and privilege to be invited to the Prime Minister's office with the outgoing president. And one of the topics that we discussed, as Minister Plevris will remember, was the importance of the agency for the assurance of quality and how we wish to work on that. And indeed, both the Prime Minister and the Minister of Health agreed that this is of the highest priority, and through that we will achieve many of the things that we wish as patients. Finishing, I will mention also that my colleague Mario Cassio, who is the Quality of Life Program Chair of the European AIDS Treatment Group, will also be presenting on some of our findings of HIV outcomes and how we wish to put forward an agenda on quality in care. Thank you very much.